Thank you for your introduction. It's my privilege to share my experiences with all the experts from the world. So my topic today is the establishment of a comprehensive management model for focused ultrasound ablation therapy of adenomyosis. Adenomyosis, due to its unique features, if the patient wants to reserve their ovaries, it is a challenge to treat it. The treatments of adenomyosis with HIFU is a new method for the adenomyosis. First, I'd like to share with you the treatment of adenomyosis with HIFU in our center. We have already treated 322 patients in our hospital, and we can see the volume of the uterus has decreased 1, 3, and 6 months in follow-up. In 3 months, it has reduced by 60%, and the remission of the disease has significantly prominent. And 21% of the patients has a requirement for fertility, and 39 cases in 2021 and 22 cases in 2022. So as for our experience of HIFU in the treatment of adenomyosis at our hospital, the basis for the treatment is to selectively ablating ectopic lesions in the uterine endometrium. It's a least invasive method of all. We should spot the adenomyosis, ovarian cyst. Pay more attention to the medical history before operation, and we should also improve the sedation and analgesia protocols. We should pay attention to the complaints during our treatment, ensure the safe, effective, and comfortable treatment, emphasize comprehensive treatment, individualized principles, and prolong chronic disease management. This is a management model in our hospital based on the patient's features. If the patient is diagnosed as adenomyosis alone, a HIFU treatment will be provided, including diffusive and focal. After the treatment, it will be classified into with fertility and without. If the patient has the requirement for fertility, GIH for 6 months, and adenomyosis, and individualized planning for pregnancy. For the patients without fertility requirements, GIH 3-month imaging evaluation. If the uterus of the uterine or volume of the uterus is less than 2 weeks of gestation, we will suspend the GIH treatment, and LNGO or adenomyosis will be provided. If she is not meeting the requirements, we will continue to use GIH for 3 to 6 months. And if the patient is adenomyosis comorbidity with ovarian adenomyosis cyst, we will provide GIH treatment. During the treatment, we have provided individualized full process treatment. However, due to the fact that the treatment for adenomyosis is long and complicated, so our follow-up is less than 50%. We will strengthen our follow-up, and we find that the patients are satisfied with the results of the operation. And different types of adenomyosis are leveled with different treatment difficulties based on MRI. The symptom relief rate for submucous myeloma is better. That of subserosal type is relatively poorer. And the efficacy of intramural type is better after ablation, and efficacy of diffuse type is worst among other types. So different MRI types require personalized treatment strategies. In formulating the plan in treating the adenomyosis. We have referred to different literatures, and we have compared the two models for treatment. We find that GRH before HIFU, the average sonication duration and treatment duration of patients without GRH treatment were shorter than those with GRH treatment before operation. So we choose to provide GRH after HIFU. And for those patients without fertility requirements, part of the endometrium can be treated. Fully communication should be conducted between the patient and doctors. And if necessary, combined with hysterectomy, not to break through the serosal surface for serosal myoma. And for patients with fertility requirements, we should pay attention to protect the endometrium. There is a case, 41 years old, experiencing progressive dysmenorrhea for over 5 years. Medication first, we can see that her uterus is as large as 3 weeks of pregnancy, anemia, and ultrasound, Doppler, and MRI indicates the change of imaging of adenomyosis. How to treat this patient? According to the consensus by the experts in China, there include intervention, operation, and medication. Intervention refers to HIFU. After discussion and consultation, HIFU with GH adopted. 46 minutes of sonication and 329 seconds of sonication. The treatment is satisfactory. And the GH 3 times add-back therapy has been conducted. The patient has contraindication to GH, and we suggest to use adenosine for post-operative treatment. As for the efficacy, the uterus volume decreased by 49% 1 month after operation, no dysmenorrhea after operation, and anemia correction. With the HIFU treatment, the dysmenorrhea has been improved, and the symptoms of menorrhagia were significantly reduced and improved after treatment. Successful pregnancy and delivery 4 months after operation. Follow-up, we suggest for mineral ring. Last, some take-home suggestions. Adenomyosis is difficult to treat. Hysterectomy is the only radical treatment at present. HIFU is a new and safer method for the treatment of adenomyosis to avoid the hysterectomy. However, it requires personalized, individualized whole procedure management after treatment. Thank you.